We're fortunate to have Dr. Jane Kelly join us today to talk about the status of the coronavirus and vaccination efforts in our state. She currently serves as the South Carolina Department of Health and Environmental Control Assistant State Epidemiologist. Thank you so much for joining us today, Dr. Kelly. I'd like to start by asking what's happening right now with the coronavirus and the development of the vaccines in South Carolina.
Well, first, I just want to begin with setting the stage about how concerned to be about a pandemic virus. Certainly, we are all worried about the spread of this virus and the mortality that has gone along with this virus. But I do want to put it a little bit in perspective. It's estimated that 80% of people who have symptomatic COVID-19 have mild symptoms, and it lasts less than 2 weeks. Most people have mild symptoms, and some people are completely asymptomatic. But it really depends upon age. Age is the biggest predictor of mortality for COVID-19. In South Carolina, 69% of the deaths have been among those people ages 71 years and up, and 87% among those age 61 and up. So younger populations, certainly you want to protect yourself from COVID-19 and you want to protect your elders. But I do want to lay it out there that part of the reason we are in phase 1A in South Carolina is because we want to vaccinate the elderly who are at most risk for severe disease. So let's talk a little bit about vaccine. A little bit about terminology. I think it's important to understand some biology, to understand how the vaccines work and what we will do if some of these new variants become more prevalent. Coronaviruses is a general term. It means a group of viruses that can cause anything from the common cold through this serious disease, COVID-19. SARS-CoV-2 is the name of the virus. COVID-19 is the name of the disease it causes. And in that drawing on the right-hand side, that's what the virus looks like under the electron microscope. The squiggly yellow and brown line in the center is made of genetic code, the genes for the virus, and made of RNA. We have DNA in our genetic code. This virus has RNA. And I want to point out that that RNA is coded by a protein coat. And it has a number of different proteins, but for the purposes of this talk, the one I want to point out is the spike protein. That's important because it attaches to the cell and then injects the virus RNA, that genetic code, those instructions to make more virus, into the cell. And that's how the virus spreads from cell to cell. And that's also how we make a vaccine. So this little cartoon on how do vaccines work, I like because it shows you that vaccines provide a sneak preview. In this cartoon, we've got a wanted poster with a picture of the coronavirus, the SARS-CoV-2 virus, and those white blood cells that are looking angry. That's because they recognize that the green spiky guys in this cartoon are the SARS-CoV-2 virus. They recognize it right away, so they can attack the virus right away with antibodies and killer T cells so that the virus doesn't even have a chance of getting into the cell. One of the concerns I've heard voiced again and again is this: how could you know that this vaccine is safe? It's been made in such a fast fashion. It usually takes years to make a vaccine. How could they make it in just a year? There's a little bit of a misconception here. There are multiple phases in vaccine development, and the longest one is the basic science research, the preclinical research. Do you remember SARS, the original severe acute respiratory syndrome? That was in 2003. About 8,000 people affected around the world, came out of China, just like SARS-CoV-2, but then spread to the United States, to Canada, and other countries. They started working on a vaccine right then and there in 2003. But then SARS, not as contagious as SARS-CoV-2, SARS was contained, and they stopped work on a vaccine, but they continued work on basic science research on that spike protein, on what's the best way if we get a virus mutation in the future to deal with such a thing. SARS-CoV-2 is 96% identical to the original SARS. So when SARS-CoV-2 was first announced, scientists knew where they wanted to go, and they were able to get a vaccine into animal studies as early as February of 2020. Then they moved on to those human studies, the phase 1, 2, 3 studies like that are on this slide. And even there, they didn't skip any steps. What they did was they overlapped steps. Sometimes in vaccine preparation, A vaccine company doesn't want to invest a lot of money until they know they have a sure thing. So phase 3 studies, which are expensive, you get recruiting human beings to receive a vaccine and be followed over 8 weeks. Those are expensive studies. Vaccine companies usually just do maybe 500 people and then look at the results and say, well, this looks good. Let's go ahead and do another 500 people. What was different for vaccine development for the COVID-19 vaccines is that those phase 3 studies, they didn't do it in baby steps. They recruited thousands, tens of thousands of people within just a couple of months. Both Pfizer and Moderna, the vaccines that are available right now, each recruited more than 40,000 people in that phase 3 study in 2 months. Let's talk a little bit about how these vaccines work. I mentioned the spike protein. None of the vaccines that are going for authorization in the United States have whole virus. They do not have killed virus, weakened virus, attenuated virus. They do not have whole virus. You cannot get COVID-19 from these vaccines. What these vaccines have instead is just a little snippet of the gene, the messenger RNA, just the gene for that spike protein. They surround that RNA with some lipids, so it's in a little, fatty capsule, inject that, it's taken up by your immune system cells, they make the spike protein, and they make antibodies and killer cells and memory cells to attack that spike protein. So if you're infected by the virus, they attack the spike protein. Remember, that's the attachment site. So the virus doesn't even have a chance of getting into your cell. There are 2 vaccines that are available right now in the United States, the Pfizer vaccine and Moderna vaccine. They're really very similar. They both use this messenger RNA. They're both 95% effective after 2 doses, which is really remarkable. It's a rare vaccine that is that effective. And there have been no serious safety concerns. We've had almost 30 million people in the United States thus far receive these vaccines. They both have some mild to moderate symptoms after the second dose, and we'll talk about that in a moment. They differ a little bit in the timing of when you get the second dose, either 3 weeks after the first one for Pfizer, 4 weeks for Moderna. We've started getting Pfizer in South Carolina mid-December, Moderna end of December. Pfizer is the one that has to be kept super cold. That's not a typo. It's minus 90 degrees Fahrenheit, whereas Moderna, you can keep at normal freezer temperatures. Right now, we're in what is called phase 1A, where we're giving Pfizer vaccine to workers in healthcare setting and Moderna first to people in long-term care facilities. But hopefully we will begin to expand as we get increased doses of vaccine. It's important not to mix and match, even though these vaccines are similar, they're not identical. And it's also important not to give the second dose too early, but it's okay if you can't get an appointment to get your second dose until 6 weeks out or longer. It's not ideal, but it's okay to give it later. I do want to talk for a moment about what is probably the next vaccine coming up. Just yesterday, Johnson & Johnson vaccine, Johnson & Johnson submitted to the Food and Drug Administration their application for emergency use authorization. This vaccine's a little bit different. It also uses the gene for that spike protein, but it's almost like a Trojan horse. Remember in Greek mythology, what the Greeks did was that they created this wooden horse and they put a bunch of heroes inside. The Trojans brought it in on their side, thinking it was a surrender gift. And in the middle of the night, after all the Trojans were drunk, the Greeks jumped out and attacked them. What's happening in this vaccine is they take a virus, just a regular cold virus, and they weaken it so it won't make you sick, but they put the gene inside so it can get into your cell and give you that genetic code for the spike protein. And what have they found testing it in over 43,000 people? They found that it was 72% effective in the United States, 66% in Latin America, 57% in South Africa. So that implies that the South African strain may be more resistant to this vaccine, but we've got more information coming. The good news is, and this is really important, yes, Pfizer and Moderna, 95% efficacious. That's terrific. However, they were looking for it to prevent any mild, even mild symptoms. Johnson & Johnson was focusing on preventing moderate to severe illness. And what they found is that everywhere that was tested, including South Africa, it was 85% effective in preventing severe disease. And there were 0 deaths in the vaccine group, even though both in the United States and in South Africa and in Brazil, where these vaccines were tested, we are all having bad outbreaks right now of COVID-19. The U.S. has purchased 100 million doses even before it's approved. We're just, betting on this Trojan horse. We purchased 100 million doses, which will be delivered as it's manufactured week by week. What symptoms go with these vaccines? Well, I mentioned that people do get mild to moderate symptoms, and I think it's important to talk about that so that people know what to expect ahead of time so they're not surprised. You may have possible soreness in the arm, achiness, feeling tired, but this is not like a long-term side effect. This is a temporary thing for 1 or 2 days, and not everybody gets that. I have a number of colleagues who've been vaccinated and said it was not that big a deal, others who had a really sore arm. So it varies from person to person. I need to update that slide. It's almost 30 million now doses given in the United States. There have been some serious allergic reactions, about 5 per million doses of Pfizer and 3 per million doses of Moderna. But to put that in perspective, about 1 in a million people who get the flu vaccine has a serious allergic reaction. So yes, this is a little bit higher, but it's not unexpected. And in fact, having that sort of reaction, whether it's a sore arm or an allergic reaction, it's actually a sign that your immune system is getting revved up. It's a sign that the vaccine is working. I want to say a little bit about these new variants. These are mutations, changes in the sequence of the genetic code in the virus. There is a British variant that's colored in the green states here. There is a Brazilian variant that's in Minnesota, been identified in Minnesota, and a South African variant, which is here in South Carolina and in Maryland. And honestly, all of these are probably more widespread than we think, more widespread than that shows in this map. It just hasn't been demonstrated. We are certainly looking for those new strains. What do we know about these strains? Well, the word mutation sounds really scary. It sounds like some horrible monster, but viruses mutate frequently. Not all mutations are important. Sometimes they don't even change a protein. They don't change an amino acid. What it looks like for the British and South African variant, that mutation means it spreads more easily. So maybe it sticks better to the cell. Maybe that spike protein is a little more efficient in injecting virus into the cell. Will vaccine work against the new variants? Yes, we know that for the British variant because they have taken people who have had the vaccine and then taken their serum and looked at the virus in a test tube to see whether that serum has the antibodies to react to the virus. So yes, for the British variant, yes, for the South African variant, but a little less effective. So there's still some protection, so it might lessen severity of illness. There is concern that these new variant viruses, if they spread more easily, we'll have more cases. And even if the variants are not themselves more lethal, more cases means more deaths. So now more than ever, it is important to do all those boring things that you've heard about with wearing a mask, staying 6 feet apart, avoiding crowds, getting vaccinated. Some people wear double masks. I've seen Dr. Fauci on TV wearing a double mask, but I know what he's doing is he wears a surgical mask that's very close fitting, and then he has a looser mask that acts almost like a shield on the outside. I would hope that people would look at the facts and realize that almost 30 million doses of vaccine have been given in the United States, and we're not seeing any serious side effects. My email address is there as well. If there are questions that we don't get to address today, I'd be glad to take some questions by email.
If someone has had and recovered from COVID-19, do they need to take the vaccine?
Great question. And it is recommended, even if you've had COVID-19 before, you're temporarily protected, probably for at least 90 days, because reinfection is rare within those first 3 months after COVID-19. But the reason the vaccine is recommended is the Pfizer and Moderna vaccines actually gave higher antibody levels than the antibody levels you find in people who had COVID-19. They're specially designed to really perk up that immune response.
And the vaccines themselves, how long are they effective? Is it a situation where you take it once and you're good for life, or is it an every year flu vaccine kind of a situation?
What we know so far is that for Pfizer and Moderna, high levels of antibodies are still existing in people who got the vaccine in that phase 3 study back in June. So we know that we have high levels of antibodies as much as 8-9 months later. So that's great news. How long will that last? Will that last for years like tetanus shots do? Only time will tell. We don't know yet. One thing of concern, though, is if these new variants become predominant, become the main virus that's circulating in this country, we might need booster shots every year, sort of like what we do with influenza, where the flu shot changes year to year. It might end up being a booster situation, but only time will tell.
We really appreciate it. Thank you.
Well, thank you for inviting me. Stay safe. Wear your mask.